It's a great pleasure to address you in this very interesting meeting. And today I will be talking about boundaries on the use of digital tools, specifically from an ethical and legal perspective. I'd like to start by stating that I have nothing to disclose in conflicts in terms of conflicts of interest. And I would like to start by, obviously as a context, saying that healthcare today is obviously permeated by technology, including digital health. And we have different examples that have impacted or are impacting or will impact the healthcare space, ranging from telemedicine and smartphone apps, different sensors, to the impact of artificial intelligence, or even writing the genome. And of course, these technologies or different digital technologies affect the healthcare workforce, as has been analyzed and discussed in the Topo review, in the NHS Topo review. Of course, this is connected with our increasing capacity to analyze and share and learn from different types of data, be it data that ranges from different omics, but also coming from electronic health records, or the so-called patient-generated data, or even data that originates from different sensors that capture the environment and can then be used for different, use in different contexts and for different opportunities in the health sector, including making health interventions more precise, delivering healthcare remotely, making sure we are surveilling the proper parameters during a pandemic, or even synthesizing data to learn from, such as the case of digital twins, or simulating different healthcare environments. Data from all these different factors should also be coupled with the social determinants of health. And we know that health outcomes are determined by different social factors that should be coupled with our constitutional factors that include our living and working conditions related with education, our work environment, whether or not we are employed, access to food and water and healthcare services, and general broader socio-economical, cultural, and environmental conditions. So these factors can influence our health, and they should be considered when we are discussing the boundaries to the adoption of digital tools. Another challenge, contextual challenge, is the constant travel that we need to make between individual medicine or healthcare delivery and public health, with different focuses on the individual patient and on population health, on the relationship that is established between healthcare professionals and patients, and a broader view on a statistical level in the case of public health, and the goals, different goals of medical treatment and acting in the individual's patient's best interests, or preventing risk and improving health for the largest number of people in the case of public health. So this calls for different ethical principles and different lenses to approach the problem. So the challenge is multifactorial, and it calls for different approaches from the ethics and the law, which bring to the table complementary strategies. Especially if we look at another factor that renders the discussion even more complex, which is condensed here in this statement by George Ennis, published in the book American Bioethics, when he says that human anatomy and physiology are the same worldwide, but the organization and delivery of healthcare reflect individual cultures. So the strategies, the ethical, legal, and social strategies cannot be the same for every part of the world. So that brings with it an added layer of complexity. If we look at it from start by looking at it from the lens of ethics, we can Of course, we know that there's a deontological body of knowledge and understanding that has, throughout time, allowed us to establish very clear duties in the healthcare sector, professional duties. We know that patients need to be informed about their treatments and procedures in a way that they understand. So we should seek to obtain informed consent. We also know that we should provide the best care possible according to the best practices. We know that we should maintain confidentiality about patients' information, and we should be selective about patients who receive care in a way that improves the care that they receive while avoid wasting health resources. And there's different ethical principles, the 4 of them listed here on the left of the slide, being the classical ethical principles that guide the healthcare interventions. There are others, but this more deontological view can be coupled, and perhaps should be coupled, with more consequentialist views that weights the pros and cons of every decision, and also with virtue ethics that focuses on individual characters and well-beings, and allows us, or ideally, it allows us to develop practical wisdom. So every ethical theory has its own strengths and weaknesses, and it's from the combination of these that we can better identify the boundaries, the ethical boundaries of digital tools adoptions. Certainly, this leads to possible different interventions that range from doing nothing and simply monitoring the situation, including other interventions that allow us to guide choices, be it through the changes of default policy or through incentives or through disincentives, and even more radical choices related with restriction or even elimination of choice. And these are highlighted here on the slide in this publication from the Nuffield Council on Bioethics. Certainly, when we are talking about restriction or elimination of choices, we are calling for the capacity of health law, which is a capacity that ethics sometimes doesn't have, to create rights and responsibilities, and also to establish principles and standards of healthy behaviors, to balance the interests of populations with individual rights, and to promote an equitable distribution of resources. And certainly we should not forget that the healthcare ecosystem is so complex today and includes multiple partners, or players, or agents that range from the biotech industry and even big technological corporations, biobanks, hospitals, patients, other companies, etc. So conflicts of interest between all these agents must be managed, and health law also allows us to do this. So both ethics and the law can bring different strategies and tools to set boundaries on the adoption of digital health. They can act as allies, not as obstacles, in order to maximize the potential of technology and minimize its risks. And these elicit, of course, different ethical, legal, and social issues that should be addressed. Now, these range from informed consent, which classically has been established on the relationship between health professionals and patients, and we should not lose focus of that, but the classical paradigms are tested in this new context. So if we, for example, when we're downloading an app, we are faced with all these terms and conditions that are written sometimes in fine print. Can we consider this to be informed consent? Or if the information is provided to us on fine print, but also too late in the choice process, when we have already made up our minds? Is this informed? Or when we are talking about maybe repurposing the use of health data, how informed can this consent be? and this needs to be articulated with different models of opting in, opting out, broad consent, etc. So there's a challenge here, or several challenges here that must be met. There's also challenges certainly related with privacy and confidentiality. And it's very difficult these days to assess the proper boundaries or the proper value of these concepts, as we see privacy being exchanged not only for security and public health interests, but also for fame, for recognition, for fun. So it's very complicated, and sometimes there's a dissonance between what the law demands, for example, by stating that health data is a special category of data, and what we observe in practical terms, where we see that these types of data are sometimes vulnerable. Security issues and cybersecurity issues have been put forward in the health sector, and have even by some been highlighted at a very serious concern. Certainly, we need to have a conversation, or keep on having a constant conversation on how to fairly distribute benefits, risks, and costs when we accelerate the pace of change and of innovation. And there's a human right to health, and also a human right to access the benefits of scientific progress. When we talk about using large amounts of data, we also need to be discussing the possibility of exacerbating data ethics issues, privacy, security, ownership, access, and transparency. And this is related with ethical and legal issues such as bias and discrimination that they always existed. They are human conditions or factors related with the human condition, but they get transposed onto the data. And then we have, for example, algorithms analyzing this data. And so both the data and the design of the algorithm systems and the usage of these systems needs to factor in the risk of bias and discrimination. We also need in this digital world to rediscover values that we know are important in the health sector, such as discernment, trustworthiness, conscience, and compassion. And these are very difficult to translate onto data. So how do we assess compassion in terms of data? It's very complicated. So we need to keep on discovering and rediscovering what these values mean in the digital world, and this is connected with the reshaping that is occurring of what does it mean to be human and to care for a human being in this world where we have AI and robots, and even more ongoing discussions which are just now emerging related with robots. What is the moral status of robots and algorithms, and perhaps the discussion, even if they deserve rights. Now, we've had during the COVID-19 pandemic a chance to look at these ethical principles and legal solutions and see them in action, and witness the potential, but also the flaws, and in some cases, the maintaining, and in other cases, the erosion of public trust. So that there's some very specific issues that were discussed, for example, related with the use of mobile apps for contact tracing, or the use of AI to select the data that is useful, clean it, analyze it, extract knowledge from it, design the proper algorithmic systems, and avoid real-world patterns of inequality and discrimination. Now, there's some lessons from the past that are important, and we should, with some degree of humility, learn from them. Certainly, social programs and resources are usually more effective than criminalizing individual behaviors. The law is essential for protecting human rights and establishing social institutions that safeguard health. And fundamental rights of individuals and the foundation for public health protection need voluntary adhesion. So the more voluntary, the more effective. And these, perhaps we can harness the power of digital tools to make sure that we underscore these principles that we have been taught to us from trying to control epidemics in the past, and that the recent COVID-19 pandemic only reinforced. And we saw this play out in different social contexts very clearly. And perhaps it's still too early to tell, but or to completely apprehend or capture the learnings of the more recent pandemic. But certainly we had some lessons from the past that we could already learn from. Now, to finish, I'll just finish with a very simple message in this last part of the talk that is condensed here in these 3 sentences that range from fiction to reality in different healthcare contexts, and the notion that we experience health and disease in very different ways. So our own individual story is very important. And the digital tools need to be able to tell that story. And sometimes when we talk about the impact of the digital technology and looking at ethics and the law, we are too focused on regulation, and we forget the why. So I think we need to be able to use technology, work together with technology. We don't need to adopt a competitive approach to it and think that we are competing with machines, or are we better or worse at doing this and doing that. We need to maybe adopt a more cooperative strategy, and while at the same time understanding that we are not just a set of parameters. We are more than or what our blood tests say, or imaging tests, and we need to put our human skills to work to understand where patients are in the trajectory of life and disease. This is a quote from a New York Times article from a few years ago. Understand the nature of the patient's family and social circumstances in order to couple scientific state-of-the-art knowledge, and where certainly digital technology can help, and couple this with genuine care for another human being. And maybe we can be alleviated from the routine work in order to focus on caring better for one another. And we can select different ethical or legal frameworks to look at this. But I think the human rights framework is certainly a very useful and adequate one. And this quote from Eleanor Roosevelt during the forging of the Universal Declaration on Human Rights, I think, is very important in the context of the right to health, and in the specific context of the adoption of digital technologies in the healthcare context, in the communicable diseases context, and certainly in the HIV context. So where do universal rights begin? They begin in small places, close to home, in the world of the individual person. The neighborhood this person lives in, the college or school this person attends, the factory, the farm or office. These are the places where every human being seeks equal justice, equal opportunity, and dignity without discrimination. And unless these rights have a meaning in this specific context, they have little meaning anywhere. So I would thank you very much for your attention. I'm an optimist, so I think we will be able in the future, by looking at ethics and the law as allies, to be able to harness the potential of technology while minimizing its risks. So thank you very much.